Okay, so this is our presentation on safe staff ratios in nursing homes, brought to you by Kate, Katie, Alexis, and Emily. So here's a brief synopsis. The American Healthcare Association and the National Center for Assisted Living covers over 14,000 nursing home facilities across the US. They announced a recent survey in 2021 showcasing the need for investment into long-term care resources. They outlined that 94% of nursing home providers have had shortages of staff members in the last month, and more than half have been lost during the pandemic. 81% of nursing home facilities have also stated that the higher reimbursement to offer better staff pay and benefits would help improve and retain staff members. The rapidly growing population of older adults is expected to drive demand for nursing homes. The number of adults age 85 is projected to reach 19 million by 2060. That's an increase from 6.5 million in 2016. So the California law currently has no mandated staff to patient ratios for nursing homes. Instead, that they just require at least 2.4 hours of direct care by a certified nursing assistant per day and a total of 3.5 hours of care daily. But is this enough? An interview for a longtime CNA caregiver in a long-term facility had summed it up perfectly, and she said that CNAs and RNs are the first line of defense. We are the eyes and the ears for the doctors, and when we are overwhelmed, a lot of things slip through the cracks. So there was a research published in the American Journal of Nursing, and it examined the total number of patient care hours in relation to patient outcomes. They found that more RN hours were associated with fewer hospitalizations, fewer urinary tract infections, and less deterioration in the ability to perform the ADLs. And they found that more CNA hours were associated with fewer pressure sores. So this study basically reflected that the more hours that our staff is spent with patients, the more prevention we can have to prevent deterioration. So the current status of our nursing homes, there's staffing shortages that cut time spent with each patient. There's increasing risks for patient decompensation and injuries. CNAs are being forced to perform RN level care, which both poses risks for both patients and practices. The nursing staff is undercompensated, overworked, and stretched so thin, it's resulting in higher rates of injury and burnout. Decades of chronic understaffing has meant unpredictable schedules, regular overtime, little support for our CNAs and RNs. And a recent study published in 2017 also found that CNAs are 3.5 times higher, more likely to be injured on the job than a typical US worker.
So the alternative that we are proposing is, instead of mandating a certain number of patient care hours, which is difficult to confirm and is likely not being met in most nursing homes, we propose passing a law that mandates nurse to patient ratios and CNA to patient ratios. So we are proposing passing legislation that would mandate the following ratios: a day shift RN to patient ratio of 1 to 10, a night shift RN to patient ratio of 1 to 20, a day shift CNA to patient ratio of 1 to 5, and a night shift CNA to patient ratio of 1 to 10. So adequate nursing staff leads to better outcomes for patients and reduces mortality rates. Several studies have been shown to prove this. For example, a 2003 study found an inverse significant relationship between nurse to patient ratio and in-hospital mortality rates. This means that when the nurse to patient ratio decreased, the in-hospital mortality rate increased significantly. So having adequate staffing in nursing homes could quite literally save lives. Inadequate staffing also leads to higher turnover of staff, which may also lead to poorer patient outcomes. For example, a 2021 study indicated that nurses' professional turnover intention is negatively related to nurse-assessed patient-centered care. nurses' professional turnover intention is also negatively related to all the 5 perceptions of nurse-assessed quality care. That is assurance, reliability, responsiveness, empathy, and tangibles. So when nurses have high turnover and don't stay at their job properly, and the new nurses have to be trained, that takes away from patient care time and ends up leading to poorer patient outcomes in all measurable ways. A third reason is that inadequate staffing leads to higher rates of nurse burnout. Nurse burnout doesn't only affect nurses, it also may lead to poorer patient outcomes. For example, a cross-sectional survey found that care quality in long-term care settings is related to staff nurses' burnout, and therefore organizations that take proactive actions to reduce burnout may see greater benefits in terms of patient outcomes. One of the main things that causes nurse burnout is being short-staffed. So again, proper staffing could lead to less burnout, less turnover, less death, and better patient outcomes altogether.
How do we implement this? The 3 main factors affecting the ratios of nursing home staff to nursing home residents are money, transparency, and regulation. To combat regulation, there are currently no requirements for healthcare aid to patient ratios. Implementing a ratio mandate will regulate ratios and ensure nursing homes adhere to certain staffing guidelines. The second thing we need to address is transparency. Currently, there are some places offer transparency, others are not as transparent as they should be. Nursing homes need to be transparent with their statistics and staff patient ratios. Websites such as Nursing Home Compare and Nursing Home Inspect allow family members to check when selecting or monitoring a nursing home. Additionally, staff and family members need to utilize accessible avenues for reporting poor policies and practices in a nursing home. Oftentimes, nursing homes will have papers on the wall with who they can call to report any abuse or neglect or any maltreatment that they see. The last thing we need to address is money. It is a very big factor that can make or break how we implement this. Currently, seniors with the most money can access facilities with better resident to staff ratios, and low income seniors are left with what they can get. An increase in state funding is needed to ensure adequate funds are being allocated to long-term care facilities. Having adequate funds will allow for fair pay of staff and will aid in the staff retention problem, and how previously it's been said that the turnover rate causes more damage to the members of these facilities. Staff retention will decrease the turnover rate. Additionally, funding will also aid in the upkeep of the facility and make sure it is clean and hygienic.
Okay, so I will be addressing some of the challenges that may come up when trying to implement these changes to the ratios in nursing homes. So potential difficulties in regards to recruiting more staff can influence how we implement these changes. So US nursing homes were difficult facilities to work in even prior to the pandemic. And there is an overall lack of empowerment and anger amongst workers even now. So staff turnover rate was high, with the median annual turnover rate for almost all nursing homes in 2017 and 2018 was 94%. So in order to keep a staff of 100 employees over a year, a facility will need to hire 94 new employees per year, which is a lot. So as Katie discussed earlier, CNAs make up the largest group of nursing home employees, and they provide about 90% of the direct patient care, such as dressing, toileting, lifting, and feeding. But they're also some of the lowest paid workers with a median annual salary of $30,000. So when we increase the staff made available to help with the patient ratios, this means that there are going to be increased costs to provide adequate salaries to all CNAs. So some solutions would be in order to reduce staff turnover rates, we don't actually have to we have to raise the minimum wage, but we can also do this by offering a wide variety of benefits to keep their workers, such as offering childcare for families, more flexible work schedules, paid leave, subsidized housing, meal services, health insurance, and counseling or support groups. By implementing these, this boosts staff morale, and it also entices them to want to stay longer with the nursing facility because they feel that they are being compensated fairly. Hiring resident care coordinators to help CNAs perform non-clinical duties such as delivering meal trays, making beds, and answering phones to help minimize some of the burden that CNAs perform on a day-to-day basis. And then allow employees to travel between states to help short-staffed facilities for a higher hourly pay to help reduce expenses and reduce reliance on external travel nursing organizations. It's been shown that utilizing travel nursing organizations increases the costs for companies significantly and for nursing homes as well. So by having employees travel between states, this can help reduce the cost. And then one of the last solutions we have is to transition away from for-profit nursing homes, which makes up 70% of nursing homes in the United States. Nonprofit nursing facilities are shown to have a higher staff level, lower hospitalization rates, and more discharges, which equals lower costs in the long term. And then here are our references. And thank you for listening.